We're continuing to talk about good health here on Good Day Arizona, and this time it's ultrasound technology. We have the folks from Southwest Spine and Sports here. It's almost a tongue twister. Dr. Jonathan Komar, Janine Noble, and our patient is Arthur Hobson, who has an injured shoulder at the moment, so I'm sorry to hear about that first of all, but how were you able to help him in a quick and efficient way?
Well, you know, ultrasound technology has come a long way since it first started in like the 1950s. And, you know, when you had an injury over the weekend, you know, if you injured yourself playing soccer or golf or something like that, you go to your doctors and they would get maybe like an x-ray, which would show bone and kind of joint space, but it didn't really show like soft tissue kind of thing. So you'd have to, at that point, probably go get an MRI. An MRI, you got to lay in a tube for about 45 minutes or an hour. It's kind of a static thing, and you got to, you know, and it takes a couple days to get it done. But now we have ultrasound technology. So in the office, it's an easy exam. It's results right away, and I have a good ultrasound technician who can really kind of show us what the shoulder looks like right away.
And then immediately, since you know what you're dealing with, you can start helping.
Exactly. And the best benefit is you can see tissues in live motion. You can actually see the motion of if there's an impingement or if there's something going on with the shoulder rather than an MRI, which is really just a static picture.
Okay. So what are we looking at here?
Actually, what we're seeing on the screen right now, this is a gentleman, actually a chiropractor, who had a lot of arm and elbow pain. And for the longest time, a lot of other medical personnel thought that maybe he had something coming from his neck. And actually, the ultrasound showed that it was really this nerve over his elbow that would flop over the bone every time he would flex his elbow. And actually, he's going to get treated for that, and he's probably going to do very well and he's actually avoided an unnecessary, probably neck surgery, because it's not coming from his neck at all. It's actually coming all from his elbow.
Your treatment is physical therapy and
injections and that kind of thing.
So you're all hooked up to something right now. This is actually a live picture?
This is a live picture. This is Mr. Hobson's normal side, which is his left side. This is what the tendon and normal tissue would look like. And we are going to take a look quickly at his affected side.
And Mr. Hobson, you've been through this a bunch of times, I'm sure, right?
Twice.
He's very graciously donated his shoulder.
Thank you so much. Now, what are we looking for here?
Now, if you see on the right side of the screen where the big, large black gap is, that's the tear that's in his muscle. And you can compare it to the normal side, which has no tear at all.
Sure.
Yeah.
So that's very easy to see.
Instant results, get it right away, and now he can get the appropriate treatment based on what we see there.
So as he's going through treatment, will you keep checking and using this exact same way to check on the progress, or will we go more by how he's feeling?
Certainly. And this can determine right away if somebody needs to go see a surgeon right away, or if we can just go ahead and continue with the conservative measures in the office. Yeah. And
what's the plan for?
Well, he's actually scheduled to see one of our good fellow surgeons pretty soon, because that's a pretty large tear for him.
All right. I keep looking for a baby in there, but I guess I won't find one in your shoulder, will I, Arthur? I hope not. So some of the things you can treat?
Yes, so shoulder injuries, knee injuries, ankle, you know, tennis elbow, golfer's elbow, even carpal tunnel syndrome we can pick up from an ultrasound. Oh,
really? So all of those can be identified by the ultrasound, and then treatment will be up to your discretion and consultation. azfamily.com is the website where you'll find all of this information. Again, it's Southwest Spine and Sports.
That's right.
Where are you located?
In Tempe and Scottsdale.
Okay. Thank you so much to all three of you, and I hope you feel much better soon.
Thank you.
Again, we'll put that information on our hotline and our website if you'd like to get in contact with them. Coming up next, a fresh look at news.